The nephrology service at this hospital belongs to one of the 6 big hospitals in the metropolitan area of Barcelona. And in this nephrology service, we provide, obviously, the usual health care to our patients. This is a teaching hospital, of course, and this is also a research hospital. And the nephrology department is actually divided into 3 areas, which are mainly clinical nephrology, so devoting our care to the patients with kidney disease. The second is the renal transplantation, and the third is the section of dialysis. We thought that the best way to organize this D-Health collaboration is in the dialysis section. And what we plan is we're going to provide two tutors to the students of the program. And we plan initially to do a clinical immersion. Essentially, we have to teach to our students the basics of the kidney, how the kidney works. And since they will be introduced to the dialysis field, we think that it will be necessary as well to give them an introduction of the scientific principles of dialysis in order to get them into our world. As I mentioned before, we thought that the best collaboration would be through the dialysis unit, because we think that we can provide training and also inspiration to these next generation healthcare professionals or innovators. During the clinical immersion, they are going to see not only patients and the medical staff treating with hemodialysis patients, but also the peritoneal dialysis procedure, the 2 procedures that which we can improve the clinical situation of our patients with the kidney failure. They will also be included into our inpatient program, into outpatient program, especially the advanced chronic kidney disease outpatient clinic. And they will also have the opportunity to attend to our program of prevention of acute kidney injury, which is one of the important lines that we have developed, and we definitely may need some of their inspiration as well to improve these unmet clinical needs sometimes. We think that the best way to do that is through a close personal interaction between the students, between the tutors, which will act as mentors during this process, during these days that they will be sharing with us. Personal interaction with the human resources that we have in our center. We do have some structural problems, but we also have some technical problems. This is one of the things that we believe that these next generation healthcare innovators can provide us with their ideas and their vision, although we do have some thoughts on these unmet clinical needs. As I mentioned, the dialysis is a complex procedure with some scientific background, which is quite easy, but definitely we need some improvements in the near future, not only in the prevention of acute kidney injury of the patients that are already admitted to the hospital, but also to improve the care of the patients that are being chronically treated with these complex techniques. This is attachment during, I think that they are gonna personally stay with us during a period of 10 days. So we think of personal attachment to our tutors, to our mentors for this period of 10 days. And it will be a close relationship among them. And on the other hand, we may also provide inspiration to them, and we also think a bi-directional relationship in order to create this improvement of unmet medical needs that we definitely have. Open eyes, open ears, actually open senses. And they will have to think that they are not going to be included in a complex dialysis program, but they may also think that our patients are suffering of different diseases, and additionally they are on dialysis, so many of the things that they may discover or they may be inspiring for them in this medical field may be also applicable to other fields of medicine, not only nephrology. Actually, the vast majority of our patients are patients with a completely different disease, and at the same time they are included in a dialysis program. But their findings, their inspiration, their discoveries may be applicable to other areas. But this is something that they are going to discover just by opening their eyes, opening their ears, opening their senses.